Hello ladies, in today's video we're going to be talking all about what is happening down there during menopause and what to do about it if you are experiencing unwanted symptoms. If you're new here, I'm Dr. Shadi Tabai. I'm a naturopathic doctor and a women's health and hormones expert. And Lord willing, every week I do make videos on different topics on women's health. So if you wanted to go ahead and subscribe and join this growing community, I would love to have you. Menopause comes with so many wonderful symptoms. You're not sleeping, you're having hot flashes, you can't remember things, and now all of a sudden your vagina is acting up. What on earth is going on? I want to talk to you about what is happening, why it's happening, and what to do about it if you are experiencing this symptom. The first thing to know during menopause is that there is an estrogen deficiency. And this impacts the pelvic floor because there are estrogen receptors all over the pelvic area. And that includes on our bladder, on the ureters, which are the tubes that connect the bladder to the outside world, in our vagina, as well as on our vulva, that's the outside of the vagina. And so if there is an estrogen deficiency, then there is less estrogen stimulation for these parts. And this can result in a lot of anatomical changes. For example, a thinning of the vaginal line, a thinning of the vaginal and vulvar tissue, less discharge being produced in the vagina. There's also a change in the pH of the vagina, where it is no longer as acidic as it was before, and so there's more chance for infection. There's also a change in the type of bacteria that grow in the vagina, where there's less favorable bacteria starting to grow. And then there's also changes with the bladder. The bladder becomes less contractible. And so when there's a little bit of pee inside, you feel more urgency because its ability to contract is less. And then also the ureters shorten a little bit, and that also can produce leakage. So all of these things create a syndrome known as genitourinary syndrome of menopause. And this includes a subset of symptoms, including genital symptoms like vaginal dryness, vaginal itching, vaginal burning, sexual symptoms like pain with intercourse, bleeding after intercourse, reduced libido, reduced ability to orgasm, and then bladder symptoms like more urgency and more recurrent UTIs and leakage. The problem with genitourinary syndrome of menopause is that it's progressive, meaning that it tends to get worse if there's not an appropriate treatment. One of the consequences of genitourinary syndrome is vaginal atrophy. And this occurs when the structure of the vagina and the vulva changes so much that there is chronic pain and discomfort. And so we definitely want to avoid it from getting to that. And I want to talk about some treatments that will help reduce the risk of progression. So you may be wondering, oh great, this all sounds so fun. What can I do about it though, Dr. Shadi? I am experiencing these symptoms. So let's go ahead and talk about some treatment options. First, I'm going to talk about some non-hormonal treatment options, and then I'll also talk about some hormonal treatment options. So in terms of non-hormonal treatment options, the number one go-to for me is the vaginal moisturizer hyaluronic acid. This specific molecule is used in skin moisture. And so we can use it in the vulva and the vaginal area to improve hydration. It's really good at grabbing water and holding on to it. And so when there's discharge or itching or burning, it can help to improve that situation. So I often use hyaluronic acid when we don't want to use a hormonal form of therapy like estrogen therapy. And I use it in a suppository. Oftentimes it comes in combinations with vitamin E, which is also nice because it helps hydrate and improve the dryness. And this can improve symptoms like itching, burning, vaginal dryness, and discomfort with intercourse. Now the problem with hyaluronic acid is that it doesn't stop the progression to vaginal atrophy. Only vaginal estrogen does that, and I'll talk about that shortly. Next non-hormonal treatment that I often recommend is actually using lube when you're having sex, and the appropriate lube relative to the pH of the vagina. The vaginal pH is about 4.5, and so we want to use lubes that also have that relative pH, because if we're using lubes on the market that do not have that pH, it can actually alter the vaginal microbiome and it can make things worse. So lubrication like Good Clean Love or Slippery Stuff has a good pH, and it can improve sexual satisfaction, reduce pain during intercourse, and improve orgasm ability. Third non-hormonal therapy is pelvic floor physiotherapy. Pelvic floor physio help to improve the strength of the pelvic floor and can help to improve symptoms like leakage and urinary urgency. So I often do recommend doing this on top of other things like moisturizers or estrogen therapy. Now I want to talk about the hormonal options for genitourinary syndrome of menopause. Estrogen therapy is the gold standard therapy for this syndrome because estrogen therapy helps to improve symptoms like vaginal itching, burning, dryness, leakage, urgency, but it can also help to prevent the progression to vaginal atrophy because it helps to improve the thickness of the vaginal wall and it helps to restore the skin folds. And so it can give a little bit of help to prevent that progression from happening. Now, vaginal estrogen can come in different forms. It can come in vaginal estriol, which is a compounded form. It can come in vaginal estradiol, which is in the form of Vagifem, or it can come in the vaginal form of conjugated estrogen, which is in the form of Premarin, which is the product. Now, I often recommend using estriol, but this is not usually covered by most insurance plans because it is a compounded product, but this is the best form of estrogen therapy for the pelvic floor because it has the highest affinity for the pelvic floor with the least systemic side effects. So it is the safest form to use and the best form for the pelvic floor. So if it's something that you can afford and can pay out of pocket for, it's an excellent option. But if you really want to get it covered under insurance, I would recommend the second option being the vaginal estradiol in the form of Vagifem. This form also works great for improving symptoms and reducing the risk of atrophy, and it can also be covered by insurance. But it does have more of a systemic effect than the vaginal estriol does. Conjugated estrogens, like in the form of Premarin, I would not use because we don't actually have this form of estrogen naturally in our body. I have made a separate video about the different forms of estrogen that I'll link above, so you can check that out. But this form of estrogen is not naturally made in our body, and so I usually would not recommend this form as it can make things worse. Vaginal estrogen therapy can be a really good way to improve symptoms of genitourinary syndrome of menopause and prevent its progression. Now, in the cases where vaginal estrogen is not indicated, you can also use vaginal DHEA, which also has been shown to help improve vaginal dryness and improve vaginal itching and burning. So this is also an option if you cannot do vaginal estrogen, but I would oftentimes prefer the vaginal estrogen before I use the DHEA. Let me know in the comments below if you have any questions. If this video did help you, please press that like button so it can reach more women just like you. And feel free to check out other videos on my channel here, and I will see you in the next video.